So on the topic of empiric treatment, when you don't have much data, don't really have justification, but just do stuff. Why did I hesitate? Why didn't I just do it instead of asking a specialist to come and do it, who may not have known anymore? So I had this lady who I picked up, which means I didn't admit her. She's been in the hospital for a while already. But she has profuse diarrhea, like pouring out liquid. She has a rectal tube in, so it's measured. Over a liter a day, which is a crazy amount. Oh, and she's old, in her 80s. Not a great combination, right? If you're young, get sick, stomach it, deal with it, gets better, survive. But diarrhea like cholera is really dangerous. People get dehydrated. It's not just dehydration. You get dehydrated here in a hospital. It's the fact that there's no nutrition. You eat it and it comes out of you. So what's the solution? Her kidneys have already failed and the nephrologist put her on dialysis. That's pretty bad, especially when you're old. I didn't think that her chance of recovering is great because dialysis actually could damage your kidneys further. Plus, there's the concept in the body that don't use it, you lose it. Stroke, not using your muscles. Kidneys, don't use it. Why do kidneys want to do anything? Just relax, don't do anything. Lots of things in life are like that, right? So the issue is the first day I came on, just saw her, introduced myself. Second day I was sitting down, spending some more time looking at it. I was like, yeah, she's been on antibiotics. She's had her stool checked for Clostridium difficile, all these other stool pathogens. We didn't check the classic ova and parasites. Not as commonly done because it's harder to do. We need lab expertise. Secondly, we live in America. If you haven't traveled, it's uncommon to get parasites. But here's the deal. She's been on IV antibiotics, ceftriaxone and flagyl. Not improved. White count keeps on climbing. Diarrhea is not improved. How does it get better? Diarrhea doesn't resolve itself. I was already thinking back to a case I seen a few years ago at another academic center where there's a lady with diarrhea and she has had it for a month. She was still walking though, so it wasn't as bad. And the GA doctors didn't know what was going on. Tried this or that. Finally, they hit upon a magical combination, Rituxan. They cured it. I wonder if we'd have to go that route with her, which is just perseverance, right? Trying one thing after next. But here's the thing. Her white count kept on going up. She's not getting better. She may be getting worse. What do you do now? So I thought about it. Yeah, I should touch base with GI. Talk to the GI doctor for a bit. Today, the only thing I see the white count going that high with diarrhea is Clostridium difficile, C. diff. But we already sent off a test, it's negative. Sent off another one, sure. Still negative. Not getting better. He'll do a colonoscopy. Look at it. We said we should probably rule out some other stuff. Make sure she still has this. Do another imaging study. What if she has abscesses? Collections in her belly that we missed? Because with many older people, we miss stuff. And even though she's on antibiotics, abscesses may not be treated because they're just too big to penetrate. Think about a ball filled with fluid. The only way you're cleaning it is from the outside. How can antibiotics penetrate when there's no blood vessels? That's where antibiotics go, right? Via the blood going to the inside. They're just on the outside, on the surface. So we did some imaging studies. She still has it. The colon inflammation. By the position, he wondered if she had ischemic colitis, lack of blood supply. But you should be getting better. She's getting worse. So later, he did do a colonoscopy, took a look. Saw some patchy exudates, stuff on the surface, not normal. Took some samples. We talked about it, said just start her on treatment for C. diff. Why not? Because we could treat it anyways. Easy enough, oral vancomycin. So we did. I stopped her IV antibiotics because they weren't doing anything. And magically the next day, She is better. She's actually feeling better. Her rectal tube has fallen out. Always a great sign because if you're not having diarrhea, your rectal tube won't stay in. Solid stool will force it out. And guess what? She also, her white count came down. That was 2 days. Should have just started 2 days earlier. What's the harm? Nothing really. Why did I hesitate? Why did I want to get somebody else involved? All very good questions that I don't know the answer to. I guess I'd like to have people helping me. When I talked to the GI doctor the first day, I already told him, I don't know if you've seen it, but pseudomembranous colitis with C. diff negative testing, that's actually C. diff. He's like, yeah. Was he saying yeah just to be conversational? Did he actually see it before? I have. So that's easier for me to do. But why did I do the treatment myself? Why did I wait? Why did I still, after the improvement, want to get confirmation that she does have C. diff? I justified it to myself saying, I'm going to do this so I could, have some stuff in the chart for a future reference. When they pull up, they could see it. Because apparently I looked at the sensitivity of C. diff testing and it's not great. Not even 90%. So you miss more than 10%. I didn't know that before. No testing is perfect. Thought a pathologist might see anything. He laughed in my face. Not really, but he sort of was scornful. Like, you do lab testing for that. I looked it up. Oh, yeah, can't tell. The pathologist can't tell. It's not like Campylobacter jejuni, which is a comma-shaped organism. Looked up C. diff. It's very complicated. But should I change my style? Should I just do stuff without any proof, just because I think so? I guess that's where the difficulty comes in, right? Generally, the doctors who just do stuff because they think it's the right thing without actually trying to prove stuff, they're not great doctors. Some doctors know what they're doing with basically absolute certainty, like Dean Winslow, the infectious disease doctor at Valley, who was also acting CEO, basically. But guess what? He said this guy has pneumocystis jirovecii pneumonia. Should probably do some testing just to prove it. He's not cocky. We test to prove stuff, even though we're certain. Yeah, we started treatment for that patient before testing came back because the lab was going to test it that day. That's a reasonable way of doing it because we're going to test for it anyways. Like starting meningitis treatment before you get the lumbar puncture. But going back, why did I wait? In her case, it made a difference. 2 days of diarrhea. Not great when your kidneys already failed. But here's the deal. Do good doctors miss stuff? Do bad doctors catch more? That's a good question. There's still a principle and a logic, a pattern behind how I do stuff. I think I just have to keep it that way because that's what good doctors do.